Now let's talk about two terms that confuse a lot of diabetic patients. And these terms are blood sugar and blood glucose. What is the difference between sugar and glucose? There are many types of sugars in nature. Milk has lactose, fruits have fructose, and sugarcane has sucrose, the common sugar we add to tea, coffee, and sweets. All the sugars, if you break them down at the smallest level, are made up of molecules of glucose. So, glucose is like a brick, and the sugars are like a house. With the same brick, arranging them differently, you can make different types of houses. So arranging the same glucose in different forms, you can have different types of sugars. So different types of sugars that we eat are broken down to glucose before they circulate in our blood. So our blood only has blood glucose, there is no sucrose, there is no blood sugar, there is no blood fructose, there is no blood lactose, it's only blood glucose. So if blood glucose and urine glucose is the right term, why do we use the terms blood sugar or urine sugar? The answer comes from knowing the history of diabetes. Many years ago, doctors saw that some patients passed a lot of urine and they labeled the condition, they named the condition as diabetes. In those days, tests were not available. So somebody had the courage of tasting the urine of these patients who were passing a lot of urine. And they found that some of the urines were sweet and they called them melichuria. Melichuria means sweet urine like syrup. So those patients who had sweet urines were diagnosed to have diabetes mellitus. Now with time, various tests were developed and then we came to know that the sweetness in the urine of a diabetic is not from sugar but it is from glucose. So the right term was urine and blood glucose. And what happened, because we have used the term sugar for so long, it became a common practice to use the names interchangeably. So when we are talking about blood sugar or urine sugar in terms of diabetes, we are really meaning blood glucose and urine glucose. So as far as the diabetic is concerned, as far as the urine and blood testing is concerned, the word glucose and sugar are synonymous, they are the same, and they really mean glucose. Maybe after a few years, after a few decades, the glucose term will be the only term that will remain. Instead of blood sugar, we will talk of blood glucose. We already started talking of glucose like glucometer, the meter that checks glucose. So these two terms are one and the same. There is no need to worry or get confused about these two terms. Another point here, when we use the word diabetes, we mean diabetes mellitus, because the other type of diabetes, which is called diabetes insipidus, occurs very rarely. More than 99.99% cases are because of diabetes mellitus. So when we talk of diabetes or when we use the word diabetes, it means diabetes mellitus. Diabetes insipidus happens in cases of brain tumor and other brain problems, and it has nothing to do with blood sugar levels at all. So do not be confused by the word diabetes and diabetes mellitus. They are used again interchangeably to mean diabetes mellitus. So we clarified two sets of terms in diabetes in terms of testing. Blood sugar, blood glucose are the same, they mean blood glucose. Urine sugar, urine glucose are the same, they mean urine glucose. And diabetes mellitus are the same terms, they mean diabetes mellitus.